live stream. So I'm just letting you know if you're someone who absolutely doesn't want to be on, I would advise like moving to the back. As well. And then about an hour or two. Mike, do you want me maybe I'll be, and then what? And welcome to this very special event here at Mayo Clinic in Phoenix, Arizona. This is a press conference, but we also wanted to make it a celebration and a special moment for our Mayo Clinic family here in Arizona, as well as Rochester, Minnesota, and in Jacksonville, Florida. Everybody has been anticipating this long-awaited larynx transplant, and there's been such a buzz about it, I know, since I joined Mayo Clinic. Well, today we are here to say it has happened. We have exciting news to share about it. And if you're watching us, thank you for joining us and being part of this announcement that is history-making and monumental. So we have a lot of exciting things to share with you. So we're going to get right to our program, of course, beginning with the person who has led us down this remarkable path to help people restore laryngeal function and again regain their ability to speak and breathe and swallow independently on their own. It was his vision 2 decades ago, and today we're celebrating that now we are realizing his hard work and the work of his team. So please join me in welcoming the director of Mayo Clinic's Larynx and Trachea Transplant Program, Dr. David Lott.
Well, thank you. Good morning, everybody. Thank you all for those of say it again now that the mic's on. Good morning, everybody. Thank you all who are here today, and thank you to everybody that's watching online. I appreciate the interest and you taking the time to share this great moment with us. So today's a great day for many reasons. I have the honor of formally announcing that the first total laryngeal transplantation in the history of Mayo Clinic was performed in Arizona on February 29th, 2024. So quite exciting. But that surgery marked many other milestones. So it was the third larynx transplant performed in the United States and one of only a handful performed internationally. That transplant is part of the first clinical trial aimed at really understanding the safety and efficacy of laryngeal transplantation. And it is the first ever laryngeal transplant, total laryngeal transplant, performed in a patient that has active cancer as part of the clinical trial. So many, many exciting firsts with this transplant and a great step towards making laryngeal transplant part of the future. So I have the honor of being able to announce that, but as we all know, this type of activity takes a team. And it's been an absolute honor to work with many, many wonderful people that have helped to make this program and this specific transplant a success. And so in regards to the transplant was 21 hours long. It took a team of 6 amazing surgeons to complete it successfully. And then it was a wonderful partnership between the ENT department and the Department of Transplantation. And without that partnership, this never could have happened. So it is my honor now to be able to introduce the surgeons that were part of the transplant. So to my left, the surgeons are sitting, so in addition to myself, Dr. Brent Chang, if you wouldn't mind standing, please. Thank you. Yeah, well, yeah, please, definitely. Next to him is Dr. Michael Heaney. Dr. Melissa Zhang. Dr. Brittany Howard. And Dr. Payam Entazami. I'd also like to just recognize at this moment my friend and colleague who serves as the medical director for our larynx and trachea program. You'll hear a little bit more from him in the future here, but I just wanted to say thank you again for all of your hard work, Dr. Girish Moore. So at this point, I want to take a step back and answer a question that probably many of you have, is what is the larynx? And you also may be asking, what is a laryngeal transplant and why is it important? So I hope to be able to answer those for you. So the larynx is here in the middle of your throat and is most commonly referred to as the voice box. But it does so much more than the voice. The larynx is responsible for our ability to breathe, to let air into our lungs. It's also responsible for our ability to swallow, to get food and drink into our stomach, and helps prevent that same food and liquid from going into our lungs. And in addition, it helps create a voice. It helps us express ourselves. So it's an incredibly important organ that really nobody ever thinks about. And when we think about laryngeal transplantation, the transplant is actually more than just the larynx. And so it does differ from person to person. But with a laryngeal transplantation, and what we did is we transplanted the larynx, the pharynx, which is kind of like a funnel that helps funnel the food and liquids into the esophagus, the upper part of the esophagus, the upper part of the trachea, the thyroid gland, parathyroid glands, the blood vessels that help to feed those structures, and the sensory and motor nerves that help to govern the activity of the larynx. So in reality, it's what's called a composite transplant that has multiple different tissue types, and formally is called a vascularized composite allograft transplant. So This, again, like I mentioned before, is an exciting time because it helps us to bridge that gap between dysfunction of that larynx and restoring its ability to work once again. As exciting as all of that is, though, today, to me, is really about two things. The first being sharing the excitement and success of this with our patient, Marty Kedian. And the second being the launch of this program, this laryngeal transplantation, is launching our clinical trial that's really geared towards helping to alleviate the severe loss of quality of life for these patients that thousands and thousands of people experience. And to truly understand why this is an achievement for our patient, you really have to understand what he and so many other people like him have had to suffer through for so many years. So you think about all those things that we talked about from how the larynx functions. If you can't breathe, you have to be able to breathe through a hole in your neck called a tracheostomy, and you have to have a tube in there that helps keep that open. It's dirty, it's very obvious, and can be socially very embarrassing for people. When you think about swallowing, imagine never getting to taste food again and having to feed yourself through a tube in your stomach. And if you think about what we do with our family and friends, especially around the holidays, as we sit down at a meal with one another, and when you can't do that and you can't partake in that meal, it becomes very obvious, right? It's an ever-present reminder of that dysfunction. And then what is probably the most disturbing for my patients is the loss of the ability to speak, to express oneself. Think about it. If you don't have your voice, you can't talk on the phone. You can't do something as simple as order through a drive-through. You can't yell for help in an emergency. And you can't tell your family members that you love them. So what happens is because of all this, it becomes very socially isolating. And my patients tell me that they tend to become a shell of themselves. And what most people tell me, and probably the most common thing I hear from my patients, is they tell me, yes, I may be alive, but I'm not truly living. And that's why this is such an accomplishment and such an excitement that we should be able to share and celebrate with Marty Kedian today. The other part of this is the excitement part is being able to push this forward. And so thanks to Marty Kedian, we're able to push this program forward. And the reason why this clinical trial is so important is because it opens up the door for helping thousands and thousands of people. The laryngeal transplants that have been performed before have shown us that they can be safe and effective, but they've been done in a very small number of people. So the number of people that can benefit from this is very limited. The big reason for this is the immunosuppression that goes along with it and its potential consequences in patients that have cancer. So most patients that need to have a laryngeal transplantation have either had cancer in the past or currently have it. And this specific transplantation allows us to truly better evaluate that. And so our ability to perform a laryngeal transplantation in a patient with active cancer who is already on immunosuppression from another transplant, done under the rigor and oversight of a clinical trial, has really allowed us to take that next step toward understanding the safety for these cancer patients and hopefully in the future having this become a treatment option for those many patients. So I'd like to close just by saying I get asked many times why I have dedicated about 20 years of my life towards researching ways to restore laryngeal function. And in reality, there really aren't any words to describe that. Really the best way to understand that is to see it for yourself. In a minute, we will bring Marty Kedian up and you will get a chance to meet him and hear from him. And you will get to see the gift that I get to see every day. And then I think you will truly understand why this research is so very important. So thank you all again for sharing this with us and for being here. And before we bring Marty up, I would like to introduce again my friend and my colleague, Dr. Girish Moore, who has been absolutely instrumental in the success of this program and this transplantation. So Dr. Moore, thank you.
Thank you. Wow, we are here. It seemed like yesterday when we started the process, actually. It's been a wonderful journey, and the most important thing for us from the transplant point of view were the challenges we face. A lot of unknowns, only a couple of laryngeal transplants done in the United States and a handful across the world. What we brought is a unique collaboration between ENT and the transplant center, which is itself a new innovation by itself. I was drawn towards the innovation. Dr. Lott has a lot of passion in this field, and his energy rubs off for the entire team. From my point of view, I think the commitment shown by Mayo Clinic leadership, all the way from top down, transplant leadership to provide us the transplant team to make this happen. My transplant team, some of them are over here. I would appreciate if you can get up and show yourselves. Please stand up. And who has been involved in this process, including over here, I would appreciate if you can come and stand up, please. So there are a few members over here. ICU, Ayan, please. ID. It takes a lot of effort to do this, and I think I don't have the picture over here, but it's a whole lot of transplant team and effort from all of us to get this done. No words can be thankful enough for us to see what the patient has done at this time. I would appreciate, go ahead, if Marty can come over.
Oh, well, interestingly, I'm also Marty. So patient was Marty and I'm Marty. So you can't go wrong. Nice work. Thank you so much for sharing your story. And I know the reason we're all here today is for the opportunity to see how this history-making procedure has truly transformed a person's life. I joined Mayo about 1.5 years ago. One of the first things that when I walked through the door as a media manager, they said, they're going to do a larynx transplant one of these days, and you're going to have to be covering that. And they said, but it hasn't happened for like 20 years. Well, in a year, here we are, right? And it took place. And to come to Mayo at a time and just watch the whole process, be here on the day that our patient and his lovely wife moved to Phoenix so that he could undergo this transplant, and to have been with them every step of the way is such a gift. So it is beyond my pleasure at this point to introduce you to the world's first patient to undergo a total laryngeal transplant with an active cancer as part of a clinical trial, first in the world. Please join me in welcoming our laryngeal transplant patient, Marty Kedian.
Hello, everyone. Thank you for coming. Sorry. A year ago, I couldn't tell you anything. But thank you to Dr. Lott and his team, and to the Mayo Clinic for the study. I have my voice back. And I'm so thankful for that. It's been a long journey, but it's all worth it in the end. Just, you know, I think of how long a journey it's been amazing. But we need more to talk more about a laryngeal transplant and how it helps people. For me, I had my first grandchild in December of 22, and I couldn't talk then. I had no voice. And my goal was to always talk to her, tell her stories. Charlotte is my life now. And I want to be able to talk to her and tell her everything that's happened in this journey. And, at that time, I couldn't. So thank you to Dr. Lott, Dr. Moore, these 5 good, great doctors for giving my voice back so I can have conversations with my granddaughter, my family, my friends. And anybody out there having an issue like this, it's tough, but you can fix it. Can be fixed. I did it. I hope you can do it. And we'll see what happens from here. But I want to thank everybody in this room. You're all a big part of my life now. You always will be. Especially my lovely wife, Gina. Why couldn't
Marty, make sure you tell us that your wife is actually how you found your way here.
Yeah, I wouldn't be here if it wasn't for her. I was told the next step in my journey was a laryngectomy. And Gina went online and found Dr. Lott after a lot of research. And we talked and talked and talked. And we said, we're going to go for it. We're going to go out there and we're going to meet with them and see what happens. I'd like to tell you all about the surgery, but I was sleeping. It's a great time. But when I woke up, I was excited when they told me everything went great. And Dr. Lott explained he couldn't get rid of my Boston accent. So, stuck with it, I guess, forever. But it's important to have somebody by your side to push you along through this journey also. When you want to give up and you just keep going, you know everything's important. Every day you wake up is a good day. That's what I try to make it now. Every day is my best day. And I hope people watching around the world understand if you have a laryngectomy or you have a voice problem, it can be fixed. You just need to find the right place. Again, I want to thank everybody. Thank you so much.
Okay, Marty, beautiful, thank you. I have had the honor of listening to Marty's story and watching their journey for the last year and a half, and it's truly remarkable, and Dr. Lott and the team are being very humble. I'll share with you what Dr. Lott shared with me, that post-surgery, it was expected that it would take up to a year for Marty to regain function, a strong function, to be able to breathe, swallow, and speak. And I would say about 4 months post-op, Dr. Lott the other week called me, he goes, "Have you talked to Marty lately?" And I said, "No." He goes, "Listen to this." He played a recording on his cell phone, and I couldn't believe it. And so, Dr. Lott, if you would come up, because I don't want to overlook the remarkable aspect of this case that at 5 months, Marty's progress is way exceeding the expectations of even Dr. Lott. What you said, you really expected to even see even in a year. Can you?
Yeah, absolutely. So just to my point earlier, you can see what I'm talking about, right? There's really no words to express what this research and this type of program can do for people. With regards to Marty, it really is, to me, absolutely amazing, the progress that he has made to this point. Now, in large part of that, the vast majority of that is due to his persistence and his work at trying to get better, and the wonderful team of people that are there to support him, like our speech language pathologists and our physical therapists and nursing staff, everybody that comes together to make that work. He's doing just absolutely amazing. So you heard how wonderful his voice sounds at this point. We hope that continues to get better. From a swallowing standpoint, correct me if I'm wrong, but you had hamburger just the other day or recently, or you tried little bits of it? Yep. So to be able to have hamburger and macaroni and cheese and things that again, I wouldn't have expected him to get to that point maybe ever, but at least not for a year or so, but he's just doing wonderfully. You can see also from the breathing standpoint, it takes a long time for those nerves that we put together to start working, if they even do work. So there is some rehabilitation that goes into learning how to breathe, but he's already to the point where he's able to cover that breathing tube and breathe on his own for stretches of time. So our anticipation is that we completely remove that tracheostomy tube, hopefully in the near future, once he's able to breathe with it completely closed.
And as we mentioned, this is the first clinical trial for laryngeal transplantation in the country. When can we expect to see, and will we see, the next case?
Yeah, great question. So this is part of a clinical trial. How we have designed the trial is we want to make sure we're doing this as safely as we possibly can. So we are going to watch and continue to see how Marty progresses to make sure that we've learned as much as we can within reason before we go on to the next transplant. But I can already feel Marty daggers behind my eyes because he wants us to do the next one as quick as possible, which is I completely agree with him. So really honest answer is once we have the next patient that is the right fit at the right time, and that could be as soon as a few months to a little bit longer.
Great. All right. Well, we do. Thank you, Dr. Lott. We'll open it up for questions. Does anyone have a question for Dr. Lott or his team? Okay. If you would come up here to the, or here, I'll give you my mic. Stay right there.
It's okay. I have a question for Marty, if he's willing to answer this. You said that you're going to share this story with your granddaughter, but it also sounds like you want to share this not only with the world, but you want to be an advocate. So how are you going to use your new voice as an advocate, you know, to make sure that this is not just one-off, that this is going to happen for thousands?
As soon as I heal a little more and I can talk a little better, I'm gonna keep talking. And I'm gonna push for as many people that need help to get the help. Because everybody needs to have a voice. Everybody.
Marty, you told me you've got one job now and you've got the next one planned. What is that? Your job now?
The first job is to get home and talk to my granddaughter. And the second one is to advocate for laryngeal transplant, voice, whatever people need. It's important. Because to live with a trach, as you can see, it's not fun. It's not good quality of life. And I want people to enjoy life like I want to enjoy life. And I enjoy meeting people and talking to different people and having a good time. So that's that, I guess.
Thank you, Marty. Thank you, Marty. Well said. All right. Well, let's see. We're going to take all of us up to Rochester now and join the Post Bulletin. Understand we have Danae Dryden, a reporter with the Post Bulletin that we work with often, and she is joining us via our stream. Can you hear us?
Yes, I can.
Oh, hi.
Yes,
Thanks for
good
joining. What's your question?
Yes, my question is, do we have any information about the donor, and where they came from, and how many other patients may have, received gifts from that donor?
Dr. Lott, would you like to address that? Question is, do we have any information about the organ donor?
As truly appreciative as we are for both the donor and family who is willing to give this gift, at this point, we are not able to give any information out about the donor. Thank you for asking.
Hi, okay, thank you, doctor. And did you have a follow-up question? We're happy to talk to our friends in Minnesota from all the way in Arizona. Any other questions, Danae?
I guess a follow-up question that I
Sure.
have would be, you know, I know that this program, this transplant program is based in Arizona. Are your colleagues at the other Mayo campuses working on, you know, similar work in laryngeal transplant?
Yeah, another wonderful question. So the short answer to that is yes. This is something that we would like to see enterprise-wide throughout Mayo Clinic. The goal for this transplant is to make it become available worldwide. So we started off to make sure things were safe and focused in one area, with then plans to expand enterprise-wide.
Thank you, Dr. Lott. Thank you, Danae. All right. I'm excited for this next guest that we'll be bringing up on the screen. So the first laryngeal transplant was actually done in 1998 by Dr. Marshall Strom. And working with Dr. Lott, I became quite a fan of Dr. Strom's, and I also learned that Dr. Lott actually spent part of his early training working under the expertise of Dr. Strom, and Dr. Strom has since then been a mentor and a great colleague and support to Dr. Lott and his work. We all love that story, and we've heard it for so long, and so it brought us the greatest joy when we learned that Dr. Strom would actually be in Arizona and then attending Marty Kedian's surgery in the operating room with Dr. Lott. It was very special. What was that like for you?
Yeah, it really is a special moment. You know, when you go through a career and you look up to your mentors and people that really define your career and your life trajectory. I do believe to some degree you owe the time and effort that they have put into building you as a person. You owe some of that back to them. And so it was a wonderful moment to be able to have Dr. Strom as a part of the transplant, his guidance, his wisdom, but to see that come full circle where the transplant that he defined and pioneered, we were able to take to the next step and hopefully now continue on to future generations beyond that.
All right, thank you. And look who we have joining us live. It is Dr. Strom, live from New York. Good afternoon, Dr. Strom. Thank you so much for taking a moment to join us.
Well, it's a privilege to be able to join you, and I will say that one of the joys of my life has been the experience professionally that David and I have been able to share over the last 20 years.
Dr. Strom, Dr. Strom joined us a few weeks ago in Phoenix, and I brought the paper that he originally published, and I had him sign it for me because I'm a big fan, a big fan now. But Dr. Strom, the question I have for you, you performed the very first larynx transplant. What has changed? What are the aspects of Dr. Lott and his team's case that you believe are significant in advancing laryngeal transplantation in the future?
Well, first, what David did, which is really significant, and established what I believe is the best research program and lab, not only in the country, but in the world today. And as you do that, then you begin to gain even more knowledge. And then what he did was he established with a lot of hard work, and I can tell you to develop a clinical trial takes a lot of work. And when you put those two together, you have an opportunity to get results like you're seeing today.
Wonderful. All right. Well, Dr. Strom, was there anything else that I enjoyed listening to the wealth of knowledge and just your observations from how far all of the technology has come? Anything else you'd like to share? The question I had was, when do you envision seeing this as a real option for the wider population?
Well, where we are now and what you see today is an absolutely critical step, because first you start with a low-grade malignancy. The next step, of course, would be to look at people that have the most common malignancy, which is squamous cell cancer. And I believe that we have the toolbox now to be able to make that happen. But everything has to occur in a stepwise fashion. And as David said, we want to learn everything we can about this patient, but the toolbox is there. And all it needs to do is be manipulated in the correct way to actually get to the point with what I call the holy grail of laryngology. And that is when the time comes when every patient who requires a laryngectomy for a malignancy will have the opportunity to select a restorative procedure that will enable them to have the same kind of quality life that you see with Marty today. And I believe we are so close to doing that. So again, as David said, I think within a 2-year period of time, it will be possible to do the first transplant for squamous cell cancer, learn a little bit along the path, and then in the hopefully not too distant future, we'll be able to offer that to everyone.
Wonderful, Dr. Strom. Thank you so much for taking a few minutes to share your expertise with us and your observations. It was a pleasure to see you, sir. We look forward to your next visit back here to Phoenix.
Thank you all so much, and congratulations.
Thank you so much. All right, if you have a question here, let me come right over here. Please just say your name and the media outlet you're with.
My name is Philip Matthews with 12 News. With this being a 21-hour surgery, how difficult is it to, obviously one doctor can't be in there for 21 hours, how difficult is it to, kind of recess the situation when one doctor leaves and another one comes in to, communicate the surgery in the whole?
No, yeah, outstanding question. So I know my name's been thrown around a lot today, but that's why this is a team approach. And without this outstanding group of surgeons here to my left, that never would have been possible. And again, the partnership with transplantation to make sure that everything other than the surgery that goes on in transplant was being taken care of so we could focus on the transplant. So we did do a team approach so that each surgeon could be at their best and have rests at different times throughout that 21-hour period.
Great question.
Was there any difficulties, that you did not expect that you had to overcome during the surgery?
Yep, another great question. Honestly, no. As a surgeon, I was the most comfortable with the surgical part of it. And to be honest with you, the surgery itself went better than I had expected. You always expect some roadblocks in the pathway, and really nothing like that happened throughout. It just went, I think, again, to accounting to the preparation that went into this, everything went very smoothly. What I was the most worried about was all the other logistics that I wasn't all that familiar with from the transplantation side of things. And again, going back to that partnership, went very smoothly also. So really, honestly, there wasn't.
Dr. How soon after the surgery was he uttering his first words? Putting on his...
Yes, so I was very strict and very worried about things healing. So although he wanted to talk sooner, then I was trying my best to keep him from not talking. I would guess that he probably eked out a few words without me knowing about it sooner than I had anticipated. But I believe it was within about 2 weeks before we really said, okay, let's go ahead and start trying to create some sound. And again, voice will progress. It'll wax and wane. Some days will be better than others. But to where he is today is just absolutely remarkable.
My question is, what happens now? Obviously, this is a clinical trial. I know you published a paper recently about this. What happens now? Where does this go from here for other, medical hospitals to, try to perform something outside of, the Mayo Clinic?
Right. Well, we understand what a big undertaking this clinical trial is, and so we're trying to look at many different aspects of laryngeal transplantation as part of this trial. So the first part is what you're seeing, the actual transplantation itself. And kind of like we mentioned sooner, we evaluate, see where things are, the progress, see what we've learned, and move on to the next and subsequent from there. And that includes things like How do we cut down the time so it doesn't take 6 surgeons and 21 hours to do this every single time? How do we make it more widely applicable across the country, across the world, so that this can be an option? The other things that we're looking at are the ethics behind this type of transplantation, having a better understanding of the risks and benefits so that we can give true informed consent to patients when they go through something, what to expect. And then understanding all the needs from a programmatic standpoint. What does a hospital need to be able to do to be able to implement this type of surgery at their hospital?
Dr. Law, I just want to just revisit the earlier point, just how significant it really is as you were looking for the first candidate. You chose a patient with an active cancer. According to the figures, the predictions are we're going to see this year somewhere in the neighborhood, I think it's 12,650 new cases of laryngeal cancer. And as you mentioned, it's a sad fact that many of those folks will possibly end up facing loss of laryngeal function. But the flip side is, how do you do a transplant on a patient with an active cancer when you cannot use the traditional immunosuppressive therapy to prevent their body from rejecting the organ because of the risks? How did you do that with Marty?
Yes, so Marty is special, and I can say that from multiple different ways. And the biggest part of why we thought he was the perfect person for this, honestly, was not because of the cancer or anything else. It was because of who he is as an individual and his drive to want to make his transplant and this transplant program work. That was the key factor. The reason we believed it was safe in his specific circumstance with having a cancer is for a few different reasons. One is he has had, that's the important part, had the type of cancer called a chondrosarcoma, which was a relatively low-grade type of cancer. So it gives us time to safely prep him for the transplantation, make sure that everything is squared away, and do so in a manner that's safe for him. That was also the focus of our surgery, is to make sure that we get that everything removed so that he's ready to move forward. The other special part is he was already on immunosuppression from another transplantation. And so we were not adding risk to his cancer or to his case by adding more immunosuppression. He was already on immunosuppression. We didn't need to really add anything for the long term. So from a scientific standpoint, that's really a wonderful opportunity, because we can safely treat Marty, but we can also learn what does immunosuppression in the setting of a low-grade cancer look like, and then infer that as to say, okay, what can we learn from that, and approach some of these higher-grade cancers as we move forward.
Well done. All right, well, I just want to ask, okay, and I have to have you stand up, Gina. Yes, she never talks. She always is like the person in the back cheering Marty on. Tell me, what's it going to be like going back to your home in just outside of Boston, and with this new life? Marty's got his voice back. Good thing or bad thing?
It all depends on the day, honestly.
What would you like to say about this journey?
It's just been surreal. I can't thank the doctors enough, Dr. Lott, and what they've done for us, especially Marty. It's just amazing. And when we get back, we'll start a whole new journey.
Yeah. Well, can I share So, little story here. So, these two lovebirds had been joined at the hip forever. And so when Gina located Dr. Lott, and they got in their car, drove out here to see if Marty would be accepted as a patient, a candidate for the surgery, they drove all the way from Boston straight to Phoenix, and Marty was accepted as a candidate. So rather than drive straight back to Boston, they made a side stop in Las Vegas, and after 15 years decided to tie the knot before they went back home. And so, yeah. I know, Marty, you're hating me for telling that. That's the story. All right, well, I have a special surprise. Come on up, both of you. I know you heard Marty and then Gina. The first thing Marty told me about why he wanted this was because of his granddaughter. When his granddaughter was born, he was a first-time grandfather. That was the game changer. And I've seen so many videos of Marty holding his granddaughter, staring at her, and I could just see just the yearning in his heart to be able to speak to her. And I could feel it in all the videos we saw. So I know we're going to miss you all when you return home to Massachusetts next week, but we know you'll be going back to all your friends and family, and of course your granddaughter. But first, your little granddaughter is the international traveler, because there she is, and she is with your son, and that is Nick Hedian, and on his right, that is Ashley, mom and dad to little Charlotte. She's grown up so much. Come over here. You have to see her on the big screen. Hi, you all. Hi, Nick. How are you?
Hi.
Hi, tell us what's happening. What do you think about Marty's voice? How amazing is this for you? You've been through this journey with Marty. What's this been like for you to see him and hear him get his voice back?
I mean, he's a pretty stubborn person, so when someone told him he couldn't talk again, he just didn't take that for an answer. Unfortunately, it runs in our genes where we have large mouths that unfortunately can't be closed. So, I mean, we're very happy for him that he was able to, get this procedure done, because, I mean, right before it happened, he was ready to just come home. We had just been there for a long visit with little Miss Charlotte, who hates us right now because we took her, to London. So we're streaming from London right now. But he saw her, and, that was his strive for moving forward. And I guess he got a little taste of Charlotte and wanted to just come home with her. But we're glad he stayed. We're glad he stuck it out. Ma'am, you have to keep your
All right, well, we have to give you the opportunity while they're on, and just to say whatever you'd like to Nick, Ashley, and of course, Charlotte.
Hey, guys. Glad you made it to London safe. Charlotte, say hello. No, we're not gonna get her. Say. Yeah, she's a little tired, I guess.
Yeah. Uh-huh. Can you say hi?
Let's say bye-bye.
Can you say bye-bye? Can you say anything?
Bye-bye.
She obviously doesn't have your gift for Gab. Not
No.
Not yet, she will.
All right, well, thank you guys for taking time out of your trip in London. Enjoy the rest of your time, and take good care of Marty, because we fell in love with this family, and we're definitely going to miss you when you go back. So thank you for trusting us with your care. And I know many times we've said over and over again, none of this would be possible without the generosity of people who make that decision to check the box to become an organ donor. So I know on behalf of the family and everyone here, thank you to our donor family, and I know, they're in our heart. So thank you. And if we don't have any other questions, and everyone is, Marty, of course, wants to say one more thing. Marty told me when I first met him, his favorite thing was to talk. And that's why this was so devastating,
No,
correct?
shut me up now. I just want to thank Dr. Strom for being a pioneer and doing the first laryngeal transplant and teaching, being a mentor for Dr. Lott to be able to do the surgery for me. And I want to thank the Mayo Clinic for doing the study, letting the study happen. Without this study, I wouldn't be able to have this type of surgery. Because as one of the surgery it is, It's not an organ transplant. It's not considered an organ transplant. And that's part of what I want to change. Because to change the quality of somebody's life with a kidney transplant, heart transplant, a larynx transplant is going to change my quality of life. Where I can talk to people, enjoy life, go out again, spend time with my family. And without the Mayo Clinic, I wouldn't be able to do that. So I want to thank the Mayo Clinic, everybody who works at the Mayo Clinic, everybody who was involved with my surgery. And I wouldn't have a voice without you. So thank you so much.
Well, that is going to do it. And so, again, thank you all for taking time out of your day to join us. Hope you enjoy this, and that this is a special memory for our Mayo Clinic family and everyone who is here to share in this. So thank you. Thank you for our colleagues watching in Florida and in Minnesota. Thank you to you, members of the media, for helping us get this message out there to advance this procedure for so many people in need. So thank you so much, and enjoy the rest of your day.